arch. So this is about the fascias. I like to go into the detail because it clears so many things up that are usually not covered if you skip this topic and try to understand them retrospectively. So the next one is the spaces. We will be talking about prevertebral space, retropharyngeal space, parapharyngeal space, submandibular space. Ignore the picture for now. Prevertebral space. When we are talking about prevertebral space, we are usually talking, especially the Snell and the undergrad books that we are reading, we are talking about the space on the anterior aspect, this space. We are not talking about whole of this space. Let's talk about this only. When for now on, when I'm talking about the prevertebral space, I will be talking about this. If we trace the prevertebral fascia upwards, it is attached all the way to the base of the skull. So the space, the upper end of the space, it will continue all the way up to the base of the skull. But if you follow down, we discussed it as the longest coli inserts at the level of T4, so does the prevertebral fascia. So this means there is a lower limit to this space, and that lower limit is T4. Do you remember this line? The line between the Do you remember the name of this line? The line that was anteriorly at the angle of Lewis and posteriorly, this is उसको sternal angle भी कहते थे, and posteriorly it is at the disc between the T4 and T5. Can you mention in the comments if you remember this disc? So this was the demarcating line between the superior mediastinum and inferior mediastinum right here. That was further divided into anterior, middle and posterior. So in other words, we can say that this prevertebral space, it is in the neck region and it is limited to the superior mediastinum. So this is the thing to remember here, because this is the question that is asked, that any infection, that is inflammation, exudate that is present in the prevertebral space, it does not go beyond this point. It does not go beyond superior mediastinum. That is the very commonly asked question. Unless and until this fascia is ruptured, or what happens? Usually, like tuberculous meningitis, there was an inflammation of the vertebra, the bleeding, the pus started to ooze out. It started to ooze out in this space, and it will trickle down and move down to this point, and it will stop trickling down because it is fusing right here. It is not moving sideways because here is a connection at this point. And when the inflammation, the pressure becomes too high, it ruptures the fascia in front of it and it moves to the space in front of it. When it ruptures, is moved to the space in front of it, we will shortly see that it is known as retropharyngeal space. Now, if you have understood and don't want to disturb your concepts anymore, put your fingers in your ear. But if you want to discuss one more controversy, I just want to tell you, because some books, even the Grays, Grays mentioned that prevertebral space includes this area also. Let me put it in a different color. Some book says that it includes this area also. So when just judge the context which you are reading. If the author has mentioned the whole of this space, then it will go down all the way to the vertebral column. But it is not usually not this case, and the books consider only the anterior aspect, so stick to that unless and until someone specifically explains this thing. Moving to the retropharyngeal space. The space that is in front of the prevertebral space and behind the visceral fascia, behind the buccopharyngeal fascia, behind the buccopharyngeal aspect of pretracheal fascia, This space is known as retropharyngeal space. This space. This is known as the retropharyngeal space. If we see up, there is another confusion right here. Here you may see an additional layer, right? This one, the orange one, the right here, drawn this one. This layer is called alar fascia. This layer is called alar fascia. So alar fascia is the one that arises. That's why I was opening my book. Alar fascia is the one that is coming from tip of the transverse process to the other tip of the transverse process, and it is running between the retropharyngeal space. So it is the alar fascia, and this the retropharyngeal space. Let's talk about it as a whole. Let's talk about it as a whole. If ignore the retroalar fascia just now, the retropharyngeal space will be present behind the visceral fascia in front of the prevertebral fascia, behind the visceral fascia, and it will move. If we move up, if we go to the base of the occiput, like you can see here, and any fluid, any bleed, anything that is present here will trickle down and go all the way down from the superior mediastinum to the posterior mediastinum, and it will be blocked only at the level of the diaphragm. So any inflammation, any exudate that is present in the retropharyngeal space, that goes all the way down to the diaphragm. So it includes superior mediastinum and posterior mediastinum. Now, one thing I want to say is here is the MCQ. So any fluid in the prevertebral fascia, prevertebral space, it's limited to the superior mediastinum. Any fluid into the vertebral in the retropharyngeal space, that will go down to the posterior mediastinum, diaphragm. So this is the MCQ, and laterally it has extensions to the parapharyngeal space. We will go into the discussion a little more when we discuss the pharynx, but I will give you a little highlight. Now we were done with the basic. Let's confuse the things a little more. Let's go into the little detail. I'm going to the detail because different one you will be reading different books. Some of you will be reading for the part one BRS anatomy. Some of you will be reading Snell's, and there is a discrepancy between the books. So what is that? So the space, the fascia that we talked about earlier, this alar fascia that is between the two transverse processes. Let's follow the alar fascia. If you follow the alar fascia right here, you can see as we move down, it ultimately fuses with the buccopharyngeal fascia in front. It is not going all the way down. It is fusing with the buccopharyngeal fascia in front. So the part of the retropharyngeal space that was behind the alar fascia, the part that was behind the alar fascia, it goes all the way down. It is continuous with the posterior mediastinum. It goes all the way down. But the part of the retropharyngeal fascia that is in front of it, that is in front of it, that is limited right here. So in the books, you will read an other terminology. The part that is behind it, you will read the word danger space. You will read the word danger space. Don't confuse it with the danger triangle. Danger triangle was danger triangle, yeah, danger area, that was in the face where you are not allowed to burst your pimples that will lead to the carotid sinus thrombosis. So don't confuse it with where that is the danger space. So these things occur when we are talking about the retropharyngeal abscess, and usually occur when you have very bad throat infection. The retropharyngeal lymph nodes become purulent, they leak out, and then they leak out here, and then you are asked the question, where will it drop down to? So that is about the retropharyngeal space. I don't have a separate slide for, okay, I have this slide, I will go through them here. Let's talk about what is submandibular space. It will be better explained after we have talked about the triangles. So, just to give you immediately, to give you an overview, let me put a pin here. I will, it will be too confusing to talk about it right now. Let's talk about it after triangles. If I forget you are live, do remind me. I will move back to this slide.